Hello, and welcome to another vlog. A couple of weeks ago, my father and I traveled to Washington, D.C. for Parent Project Muscular Dystrophy's annual advocacy conference. The purpose of the conference was to lobby for Congress to pass some important legislation to support people with muscular dystrophy and other rare diseases. So, we flew to Washington on March 7th, and we ran into a few issues getting there, especially related to getting my chair on the plane. But we did make it there safely. And once I was there, I met a lot of people. I learned a lot. I met with a couple senators' staff members to discuss some of the legislation. And of course, I even got to do some sightseeing, which was pretty cool. And even though I'm not American, I decided to go to the conference because I thought it would be a good opportunity to get to know some of my American counterparts and the issues that they're fighting for so that I can take that information with me when I meet with my government representatives here in Canada. Anyway, we flew back home on March 10th and got home safely. And as you've probably guessed, I am currently in self-isolation. I've got about a week left, just in case I've been exposed to the virus. And that leads perfectly into what I want to talk about today. If you've been on social media or you've watched the news, you know that there's a lot of talk about the virus. But there's also a lot of misinformation. So I thought today I'd debunk some common myths about the coronavirus and also share the facts with you. So let's get started. Myth number one: if I catch the virus, I will die. The fact is, most cases of coronavirus are actually quite mild, and some people don't even show symptoms right away. So your odds of succumbing to the disease if you catch it are actually quite slim. Now, that being said, people who are immunocompromised, such as seniors and people with chronic diseases like myself, are at a higher risk because we're more vulnerable, and those are the people that we do need to take steps to protect. Myth number two: there is no way to prevent the virus. In fact, there's actually quite a few things that you can do, most of which are pretty easy, to help prevent the spread of this virus. First and foremost, wash and dry your hands thoroughly. You should wash your hands with soap for at least 20 seconds and then dry them well because wet hands can spread germs. Also, try not to touch your face. Yes, it's easier said than done, but it is important that you make an effort not to do that. If you have to cough or sneeze, try to do it in your elbow or a tissue and then throw that tissue out as soon as you're done. This should go without saying, but make sure you avoid sick individuals. And if you do have to leave your home for any reason, practice social distancing. So you should stay at least 6 feet away from other people because that's how far the virus can travel from one person to another. And if you do that, that greatly reduces your chances. And then, of course, you should limit international travel, which shouldn't be too difficult with all the travel restrictions. And finally, if you feel like you've been exposed to the virus or you might have it, then you need to self-isolate or self-quarantine. This is the most important because this will help to protect those vulnerable individuals and help to flatten the curve. Basically, you've probably heard that phrase a lot. It's basically a fancy way of saying we need to spread out cases of the virus so that it doesn't overwhelm our healthcare system, because obviously our healthcare system has limited resources, and if it can't handle the outbreak, then it's just going to make things worse. And before you complain about the restrictions, it's important that you remember those vulnerable individuals that I mentioned. So before you start complaining about it, just think about your friends and family who may be at risk, because that's who are most at risk, and that's who we're trying to protect. It's not just about protecting people who aren't at risk, it's about protecting those who are the most vulnerable. Myth number three: I should stock up on groceries and medical supplies. Actually, you should only buy what you need. When you hoard supplies like, wipes and hand sanitizer and toilet paper, it just takes it away from people who need them. The people who need those cleaning supplies most are the vulnerable individuals. For me, where I'm immunocompromised, I'm on a steroid that reduces my immune function, and I also have some cardiac and respiratory issues, which just increases my chances of developing complications. I need to do a lot of cleaning to make sure that I don't contract the virus. And that's one of the reasons why I'm self-isolating. So just, only buy what you need. If you need 60 rolls of toilet paper to get yourself through a 2-week quarantine, then you need to be tested for something else. Myth number four: Extreme temperatures can prevent the virus. Unfortunately, weather does not have an effect on the virus. It would be really cool if cold or hot weather could stop the spread of the virus, especially with summer coming up. But based on what we know about viruses, that's unlikely. It is possible that the cases may diminish some in the summer months, but that's not to say that there won't be a resurgence. So it's important that we don't get complacent. But based on what we know about the virus, it's unlikely to diminish come the summer months if we don't get the pandemic under control. Myth number 5, I should stay away from people from other countries. Now, the fact is, the virus can affect people regardless of their race or culture. There is never any excuse to be intolerant, so please stop avoiding people from specific countries and cultures because it's not very nice. Be respectful to other people, especially during this difficult time because we could all use a little compassion. Myth number 6, I should stop eating Chinese food and drinking beer. No, just no. Chinese food and beer do not cause this virus or any virus because that's not how viruses work. Right? In order to get this virus, you need to catch it from someone who has it or get it through community spread. But you need to be in direct contact with other individuals. Myth number 7, pets can get the virus. Right now, there's no evidence that animals can get the virus, so you don't have to worry too much about your dog or your cat getting it. Perhaps it might be possible that they can spread it indirectly, but again, there's limited evidence to support that. So, just you should probably still wash your hands after, petting your dog or cat, but you don't have to worry about, taking them to the vet for this virus because they're not going to catch it. And then finally, myth number 8, now is the time to panic. The fact is, you should never panic because when you panic, you act irrationally and you do silly things, which just puts yourself and other people at a greater risk. And if we panic and don't keep our heads on tightly, all we're doing is risking making this pandemic worse. So it's very important that everyone, think rationally and behave logically and take the restrictions seriously. So that's just a quick look at some of the most common coronavirus myths and the actual facts. And I've included some links in the description below for anyone who wants to learn a bit more about this. Anyway, if you enjoyed today's vlog and you want to see more videos like this one, then please like, comment, and subscribe. And as always, if you want to help me to make more videos like this one, then please support me on Patreon. Anyway, thanks for watching and see you in a couple of weeks.